here we are, week 2. I'm dealing with throat and neck cancer. And this thing they call stage 4 malignant squamous cell carcinoma. So I just wanted to start off, I think last one I ended on Friday, and wanted to tell you what happened since then. I wrote some things down because it's easier for me just to kind of remember what went on through the week. So Friday, actually I lost the taste of everything in my mouth except for like sour. I'm able to taste that a little bit. Friday I was also feeling a little queasy, Friday and Saturday, and I think it's just from the chemo. And I should have taken the anti-nausea meds, but I didn't because I don't like to take a lot of meds. But I should have took those. Also, I found out that some of those mexidextrose or whatever it might be, was also steroids, which can help alleviate some inflammation, which I'll talk about that in a few minutes. On Saturday, I stayed home, and I slept most of the day on Saturday. Probably, on and off, an hour here, 2 hours here, all the way up until, about 8 p.m. I started getting some chest pains, and it just felt like there's just a tightness around the heart. I took some Advil and some Prevacid at that time, and it seemed to alleviate that, and I went to bed at 9:30. I didn't wake until 9:15 the next day, which is unusual because I usually can go on 6 or 7 hours of sleep, and it was unusual to sleep almost 12 hours straight and not even get up. But that's what happened. So I think that day on Saturday I probably slept somewhere around 17 hours that whole day on a 24-hour period, which was unusual. Sunday, got up that morning, I got a shower, and Cindy said to me, you look kind of pale, and my skin did look kind of pale, and I was telling her that I was having kind of, that pressure again in my chest, feeling those chest pains, and she said, well, maybe, the pericardium around your heart could be inflamed, it could be enlarged, causing that pressure, which is like a pericarditis, and let me call the doctor. So she called the doctor, and the doctor said, yeah, these meds can cause heart issues, so maybe, you want to go to the ER. Or he didn't say maybe, he says get to the ER. So we ended up going to the ER around 11 or 12 o'clock, and we were there for a few hours. Basically did a chest x-ray, found that the heart was okay, things seemed to be pumping okay, EKG was okay, and they also did blood work, and the blood work came back okay except for my lymphocytes, which should be on a 15 to 45 range, and I was a 7. So those are those little white cells that help fight off infections and stuff like that. I wore a mask in the ER, so this way, anybody coming in, throwing up and making a mess, hopefully I didn't catch anything. And I don't think I did because it's almost a week later. It's Saturday after the Sunday I went there. They gave me a GI cocktail, which kind of numbed my throat, and also some Prevacid. And they said, that is probably what it is. It's based upon the examination of my throat. It looks like esophagitis caused by the radiation, which basically is like acid reflux. They put me on a prescription of Prevacid every day, every morning, and so far since then I haven't had those pains anymore, and it seems to quell that problem. Monday through Thursday, well actually Monday through Friday, I started the radiation treatments again every day, and it takes about maybe about 20 minutes to do those radiation treatments per day. They strap your head and your shoulders to that table, so you can't move anything, and then the big machine goes around, and for me they're giving me 4 1-minute doses, and they're irradiating everything for 5 weeks through my neck and in face area here. The last 2 weeks they will get specific on the targets, is what my radiologist oncologist said. So as of Thursday, I've been eating okay. There's just no taste. There's no flavor in anything. So if you eat a piece of pizza, it's it tastes like cardboard. The one thing I did learn is that stay away from like spicy stuff like pepperoni or sausage, because that actually burns the inside of your mouth. The inside of my mouth feels kind of like, after you've had that hot piece of pizza and it's burned the roof of your mouth and your tongue and everything, and you can't taste anything for like a couple of days. That's kind of what my entire mouth feels like, including the dry, spitty, stringy type of spit. So you've got to drink a lot. I've been gargling with the salt water and baking soda, which seems to help a little bit. Also the biotin seems to help a little bit, and that's been 5 to 8 times a day. I'll probably have to do more as time goes on. Right now I'm getting a little cotton mouth from just talking without having a sip of water, so always carry a bottle of water with you. I found that I can taste a little bit of chocolate. There's just a little flavor of chocolate. I don't know why. Souring tastes, I could taste a little bit. And I've also been drinking watered down grape Kool-Aid, which I can taste just a little bit, but it gives some type of flavor in otherwise a bland world. Thursday night I started getting nosebleeds overnight, and that's even with a cool mist humidifier. So I think the radiation inside the nose is, just opening up some surface blood vessels, and it's nothing like a major nosebleed, but it's just, you wake up with that blood in your nose and the coagulated blood in your nose, and you have to blow your nose a couple of times during the night. Friday afternoon, I started getting radiation burns on my neck, which are very irritable. The nosebleeds were a little bit more prevalent Friday night, and uncomfortable, and it's also last night it was very difficult to eat just like a sandwich. The chewing and the swallowing is becoming more difficult. Right now it just feels like a minor sore throat. I did have some chicken noodle soup, which that helped. It helps feel a little bit better inside the throat. And this morning I had some eggs and some buttered noodles, which also helped. But it's like this little sore throat. But I've got 2 days off. I'll let you know how it goes. I don't feel any effects of the chemo anymore. It was only those 2 days of Friday and Saturday that kind of the chemo effect kicked in. It really doesn't feel like a lot. They gave me, it was 7 hours of that chemo therapy, which started at like 8 in the morning, and they started with a couple liters of fluid, and then they gave you some anti-nausea bags of medication, got that into you, then 2 hours of 2 liters of the cisplatin and the chemo, and then another bags of fluids and another small bag of something else. I don't even remember what it was, but it was about 7 hours. Peed a lot, once they put the fluids in, they want you to do that, so this way they keep the kidney function going. But it seems like the kidneys are function okay based upon the blood test on Sunday at the hospital. So that's been the week. I'll fill you in next week, let you know what's going on. But till then, hope I have a good week. Hope you do too. Bye.